much. Your Excellency, the Governor of Mandera County, Honorable Cabinet Secretary for Health, who is our chief guest, Your Excellency, the Deputy Governor, our County Commissioner, Head of IGAD Mission to Kenya, members of National Assembly, our guests from Nairobi, the Taskforce Chair and the Health Taskforce Reforms team, the county teams, and our ZES. Assalamu alaikum wa rahmatullah. Your Excellency, it gives me really great pleasure to welcome our Cabinet Secretary for Health, and this is the first time for the last 10 years that the Cabinet Secretary for Health has visited Mandera. So without taking a lot of time, I know we have passed through a number of places and time is also not on our side. I want to go straight to the program, and here the first program that is here before us is the task force presentation. But before that, allow me just to recognize one group of people so that they stand up and wave and sit from where they are. The health team who are in the house, kindly be upstanding and wave. Asanteni sana. This is just part of a small part of the entire health team. May I now take this opportunity to welcome the task force that has been formed by His Excellency the Governor to look at what are the issues in health for us to be able to be on the first leg, be the first county and the best county among the 47 counties. I know we had a long journey. We came from very far. But Excellency is a moving target, and that is why His Excellency the Governor formed the task force to still look at what are the many or medium or small issues that are there in health that requires for him to address for Mandera to be the best county in health service delivery. So may I now take this opportunity to welcome the Health Task Force to present, to give us a short presentation before then I call on the chair. So the Task Force.
Jambo wananchi. All protocols observed. The Governor, Waziri, Commissioner, Members of Parliament. My name is Kama Rogo. I had the privilege of being asked by the Governor to chair this task force. We shall be time conscious and very, very strict on what we give you. We have a big report that has been printed, so you'll have a chance to read it. Let me first and foremost to ask my task force members to stand up so that you recognize them. Task force members, tafadhali simameni. There are only two more who are not here. One of them, Khadija, is in Yemen. So they are all Kenyan, they are all patriotic, they are all black. Allow me to ask the two people who are making the presentation to come up, starting with Dr. Bashir, who, by the way, is your own son. Thank you, Bashir.
Honorable Chief Guest, the Honorable Minister, the Governor, His Excellency of Mandera, His Excellency the Deputy Governor, all elected leaders, all protocols observed. Being cognizant of the time factor, it was it's about 5 months of journey, and today we are happy to deliver the baby that will see Mandera health sector prosper. If I'm very fast, you can stop me, but I think you'll love it when I'm faster. I'm happy to present the first few slides of this report. The report is quite bulky. You can have the soft and hard copy later after the launch. But we are presenting a summary of our findings together with the recommendations. So the name is Mandera Healthcare Reimagined, where every household is identified, reached, and served with dignity. That encompasses the vision of our report. The findings and recommendations only. We've approached it through the health systems. Introduction-wise, in fulfillment of his campaign pledge of transforming health systems, His Excellency the Governor, Mohammed Al Khalif, established this task force in October last year by that Gazette notice. The core mandate of the task force was to review and propose reforms in Mandera County health system. Not that things are not happening, but to reform it so that they can catch up with other parts of the country. And we can deal with issues of inequity. Good. So these are the task force members who are introduced to you. Our chair is our professor and our teacher, Professor Hamarogo. We approach this through the task force assess the health sector using both qualitative and quantitative approach that's structured along the health system building blocks, which are 6 in number: health governance and leadership, There was synergy between the departments of public health and medical sciences within the same department. The public health system is not connected to the community. The community sees the health system as something foreign to them. There was a blockage county health management team and unclear job descriptions, risks, and funding for county health committee teams. County Department of Health budget was managed by Treasury and not by the Chief Officer of Health. And there was a disconnect between the state committee, sub-county committee, and hospital management team at the hospital and sub-county level, resulting in dysfunctional health management. In the recommendations, we recommend that the county develop its own health policies, strategic plans, and review the Health Service Act 2019 that we found to be flawed and difficult to implement, to capture the policy vision and facilitate the implementation and recommendation of this task force. We have one chief officer and 2 directors, one for medical services and one for public health, supported by a strong technical team of deputy directors and heads of programs. We recommend that we report respect for hierarchy at all levels of management, from the CECM, the facility level, and vice versa, so that we get a functioning system that's smooth. The chief officer must be also autonomous as an accounting officer for the functions and budgets under the department to support the CCM in sector leadership. Review current departmental organogram. Coordinate
cluster the CHMP positions and the functions with well-defined COIs and competitively and meritoriously appoint the leaders of the functions, not exceeding 15,000, who shall compromise the full CHMP members. So we are happy with something we found out. Consultatively review the hospital boards and primary health care facility committees selection criteria, which will guide the County Health Service Act of 2019 and constitute them transparently as per criteria agreed upon in the revised Health Act. Consider a member of the CHMP to support partnerships and public-private partnerships to examine the private sector is completely aloof the health system and it was completely quite a huge proportion of service delivery. Train and mentor the technical leadership of HRS management. So once we constitute the CHMP, the core CHMP provide them with support, leadership and management. The next building block is the healthcare financing. What we observe is assessment and need for health is limited, and the Department of Health primarily relies only on the county allocation study, charitable revenue. The Department of Health received 19% and 23% respectively in 2022 and 2021. The SRH took up to 46% of the budget, the total health budget, and it's approximately that 1.1% of these goes to preventive and promotion, which is the core of our PHC. The department underperformed in critical revenue mobilization, such as the schools of NHIS, the super cover, the Linda Mama, the aid last year, claiming only 50 million shillings with over 200 facilities, while the private sector, mostly in this town, claimed about 295 million. So it achieves the disparity between the public benefits of the NHIS and insurance schemes. The county will get to pass legal provisions to guide collection, retention at source, and use of the user fees at level 4 and level 5 hospitals. User fees are currently collected by the county revenue department as part of the county's own resource revenue. The primary healthcare facilities solely rely on the NIDA on conditional grounds for operations and management and maintenance, while the media NGOs and UN support are off budget, so you're not able to capture that in your budget. The sector planning and budgeting process is not compliant with CFM Act. In the product is uncoordinated and crude and is comparable to pre-demolition plans. The department's annual work plan was not program-based budgeting, compliant nor is implemented. The budget execution was centralized at the county treasury, where all spending decisions are made exclusively by the Department of Health Leadership. There was no oversight and audit of the funds allocated to the department and hospitals, as the hospital boards and primary healthcare facilities committees are non-existent and creating avenues for leakage and pilferage. The recommendations for health financing: develop county policy and strategy for resource mobilization for health sectors based on the National Health Financing Strategy or policy, including adoption of Mandera UHC one boot scheme, where every family can donate one boot per year to have a family cover. Invest in increasing NHIF uptake and processing of NHIF claims, including hiring clerks, particularly to process and submit claims to ensure 100% payment of these claims. The governor has already started, and I think there were also national government programs on the destitutes being covered. Consult and enact the FIF bill, the Facility Improvement Fund bill, to provide enabling legal framework to guide funds allocation, clear criteria and management, including user fees in compliance with the PFM Act. Recommends a percentage of user fees collected at level 4 and level 5 to support community health services. And that's where we're going as primary health care. The FIF bill to prioritize funding to primary health care include recommending 7 to 8% of total budget allocation to primary health care facilities. As we've realized, we have allocated to 1.1% for now.
and also the same bill to prioritize, implement the primary healthcare financing transition plan 2022-25 before the planned phasing out of the NIDA grant. You know, all donors are walking away because we have come to a level of mid-level income country, and donors are giving us time to transit, to take over the whole of our load on healthcare expenditure. Streamline off-budget support from other partners, implement a coaching and mentorship program spanning 2 budget cycles for all levels of the county leadership in health on planning and budgeting, track quarterly and annual expenditure to monitor budget performance and ensure proper absorption and reporting. Appoint, train and gazette hospital boards and facility management committees for effective planning and accountability. Establish a health sector stakeholders forum for the county and establish a similar arrangement known as health sector working group as recommended in the midterm expenditure framework for us to have proper structures for implementation and accountability. Conduct a comprehensive internal and external audit of the health department, including the AIE receiving health facilities, to provide baseline for future audit and to inform appropriate financial management reform to be instituted. There has been a huge focus on the, this is construction, health infrastructure, our third pillar. There has been a huge focus on the construction of health facilities to increase access to healthcare services in Mandera since devolution the last 10 years. However, some of these facilities are either partially operational or incomplete. About 15 primary healthcare facilities are non-operational at the moment, and the rest are half operational. Building health facilities was deemed political and there was inadequate. In some cases, there was no prior consultation with the stakeholders, including the county health management teams or the sub-county teams and communities, to ascertain the need and build according to the response to the needs. The infrastructure norms and standards were not followed in building some of these health facility buildings, and user department heads were not consulted. The infrastructure, half of the sub-county level 4 referral facilities do not meet the norms and standards at the relevant KEF level, Kenya Essential Package for Health for level 4, especially Kutulo, Lafe and Banisa require some help in terms of coming to the level 4 standards. The facilities were built where there are no supporting amenities like water, electricity, good road network and security, making it difficult to operationalize some of the facilities that have already been built. The county procured and distributed modern medical equipment, including obstetric equipment, to all health facilities in the last 5 years, but lacked standardized specifications to inform investments in equipment. Some equipment remained unused and some were obsolete and littered the stores and the yards of the hospitals. There were no maintenance plans for medical equipment, including cold chain equipment at all levels, and laboratory equipment for that matter have not been calibrated for more than a year. So the results and the standards itself is wanting. There was poor asset inventory management across the county. Specifically, Mandera County Referral Officer did not have an asset inventory with all those equipments that you have. None of the facilities had digital asset tracking mechanism, despite availability of computers and internet in the county. Our recommendations are stop constructions of new primary healthcare facilities for the next 5 years and prioritize operationalization of the existing primary healthcare facilities. Upgrade the 7 existing level 4 hospitals, including MCRH, to meet and operate at the KEF level 4 following the structural requirements as per the infrastructure norms and standards. Upgrade the health centers in the proposed new sub-counties of Kiliwehiri, Galaleo, Arabia, and Asabito to fully functional at level 3B. Develop, fund, and implement annual preventive maintenance plan for equipment, including incinerators, solar fridges, and appliances. They are very expensive equipments. If we don't maintain them, then we end up buying every year and end up littering the yards every year. Develop local solutions for water and power that include improved water connectivity, storage and use of solar energy in all health facilities in collaboration with the county departments of water, energy and irrigation. water. Explore outsourcing maintenance in the short term as maintenance staff capacity is strengthened and the numbers are limited. Standardize equipment for ease of servicing and related support, as well as provision of consumables. Support placed or leased equipment by a full contract for service and maintenance and supply of consumables, so that you don't have the headache of equipment being not functional for very small items. Digitize asset inventory on all hospitals and primary healthcare facilities. Proper disposal of obsolete assets to decongest the facilities, and greening and proper environmental management of all health facilities to create a therapeutic environment. Service delivery. Government facilities doubled from 54 in 2013 to 112. That's quite a commendable job. Hence reducing the distance to seek health services. Number of health workers also increased from 154 to 1227. Specialized services as renal, ICU, and diagnostic centers, as we've seen in the hospital, especially at MCRH. Oxygen plants are MCRH and the LWAC sub-county. During COVID, this was very useful. Improvement in key performance indicators in the KDHS between 2014 and 2022. Those are the indicators. Our maternal mortalities, 2013 was at 795. This was this was a top county in maternal mortality, where we had a project from UNFPA and Danida. A focused, targeted effort was done, and with the help of the county and devolution, we have managed to bring the results to 385. But our target as a nation is 70. Skill delivery, nationally we are at 87%, but Mandera is at 54. So it's also the lowest in the nation. Stunting reduced from 26 to 21%. Fourth antenatal care is about 40% now. The under 5 mortality and under 1 mortality have increased. Could be related to due to low penta-3 coverage of vaccination and malnutrition. Low prioritization and funding of primary healthcare services we have mentioned earlier, including community level, level 2 and level 3, and public health services, which should ideally be the drivers of our universal health coverage. There was only 26 community health units against 200 community health units according to the population. And even those are done by partners and they are not funded. So they are half functional or not functional. The low availability of laboratory diagnostic equipment and commodities at level 2 and 3 is very glaring. Lack of diagnostic radiology equipment and lab tests in some sub-county hospitals due to lack of equipment and reagents is also something we need to address for operationality of those facilities. Some comprehensive specialized services provided at hospitals are weak. No pediatrician during our interviews, ENT or orthopedic service at MCRH and the sub-county hospitals. Physiotherapy, dental, eye, ENT, ICU service are suboptimal, lacking in most level 4 facilities. Available specialized clinics, medical outpatient clinic, gynecology outpatient clinic, surgical outpatient take place 1 day in a week in MCRH, and that is not ideal. At least you should have 3 clinics per all those specialties. Rehabilitative services are underutilized due to lack of space and equipment and also human resource. The community perceived the quality of health service to be poor because of because of frequent drug shop stockouts, disrespectful attitudes of the health workers, and long patient queues. So those are issues that may not require money, but just requires the adjustment of our systems and our mindset. Establish functional, these are the recommendations, primary healthcare implementation structures, the technical working groups, and the multidisciplinary teams to implement primary care networks in all the sub-counties in Mandera as part of the Kenya Primary Healthcare Strategic Framework. Review, enact, and implement the draft Community Health Service Bill 2021 and the FIF Bill to guide county in investments in community health services. Establish and operationalize the 200 community units over the next 5 years, bearing in mind the bills that will help you implement. Each community unit will cost you 757,000, totaling to 151 million over the next 5 years. So it's not a lot of money if you go by progressive implementation. Revise the FIF bill to ensure allocation of 7 to 10% of the health budget to community health care, which can be raised from proper utilization of NHIF in the primary and secondary health facilities. 15% of the funds raised from the level 4 and 5 should also go towards primary healthcare services, provide and expand specialized services such as orthopedic, trauma services, specialized clinics, renal unit, ICU, and all those I have mentioned in the referral hospitals. Deploy specialists to sub-county hospitals based on need, and arrange clinics or surgeries in sub-county hospitals rather than posting a full-time specialist there. Adopt and provide resources to progressively implement quality improvement and quality assurance activities. And we believe we've done a lot, especially on maternal care, and still our maternal mortality not coming down because of the quality of care. And that's where the focus of the main ministry is. Establish and strengthen emergency referral structures and mechanisms across the continuum of care. I'll stop there and allow Dr. Janet, a member of the task force, also our staff from the Ministry of Health. So the ministry has contributed a lot.
Good afternoon, all. Honorable CS Susan Akumincha, His Excellency the Governor Khalid, His Excellency Deputy Governor, members of Parliament and Senators. I will continue from where my colleague has left off and talk about health products and technologies. So our findings are that Mandera was up to date with the KEMSA payments, one of the few counties which were up to date, and that is commendable. We, however, found that there was persistent stock out of HPTs across all levels of care, and this was mainly due to inadequate budgetary allocation for the HPTs. KEMSA was the main supplier for the HPTs in Mandera, but the order fill rate was low at 48%. This was because we did not quantify and forecast the amounts that we needed and provide that order early enough to KEMSA to be able to deliver the supplies. We had private vendors and framework contractors now who would supply what KEMSA could not supply, but they were charging up to 700 times. Provision of spare parts and training on usage of and installation of equipment was lacking. So when you have different types of reagents for different machines, then it makes it difficult when you're procuring to procure different reagents for different machines. So the recommendations are therefore to increase budgetary allocation to HPT procurement and ring-fence it through legislation in the county acts. Work with the county KEMSA focal person. KEMSA has a focal person for each county so that we can improve the quantification and forecasting process for drugs in a timely manner to provide this order in a timely rate, therefore we increase our order fill rate. Stop all existing framework contractors because it does not make sense to pay 700 times the cost, so that we can therefore plan adequately and get this from KEMSA and choose a credible alternative source of HPTs. In this case, we have MEDS. And where framework contractors become necessary, prepare a general price list for all health suppliers based on the prevailing market prices, so that when suppliers are competing, we already have a price list which estimates what the market value should be. Then we need to adapt quarterly order cycle for both hospital and primary facilities. Currently, the orders are done twice a year, but ideally 4 times would improve the availability of commodities. Strengthen the use of ICT systems for supply chain logistics inventory management to create accountability and reduce pilferage of the commodities and drugs. Expand storage capacities of the county facilities with more spacious, automated, modern, well-managed warehouses within all the facilities. Then we need to sensitize healthcare workers on the rational use of health products and technologies, monitoring and enforce adherence to clinical guidelines and essential lists in the diagnosis, prescription and procurement for HPTs for proper drug use. Then we move on to the next pillar, which is human resource for health. The human resource are the driving force for health system. If we get it wrong at the human resource level, then we cannot achieve this universal health coverage. So the key observations and commendation was that we've increased from 154 members of staff at devolution right now to more than 1,227 as of December 2022. However, challenges started from recruitment and deployment of healthcare workers, which the health workers displayed or said was tainted by political influence and clanism rather than technical competence and merit. So those who seemed connected were seemingly deployed to favorable places. Deployment was skewed to hospitals. So 57% of the human resource in Mandera County are distributed among 7 level 4 facilities. Of this 57%, Mandera County referral has 28%. So half of those who are the staff are in level 4 facilities, and half of which are actually in Mandera County Referral Hospital. The other 43 are now distributed among 105 public health facilities, so they are grossly understaffed. There was delay and skewed promotion for staff working in the County Department for Health, and there was lack of clear policies and plans on staff training and opportunities for professional advancement. The management and supervision of medical officers and specialists was unclear, and there were local arrangements whereby you will have an officer working a certain amount of time and away for maybe 3 months. Therefore, the increase in number to the community did not feel like it was commensurate to the increase in availability of services. The sub-county health management team had a limited role in staff management, transfer or discipline, with all the decisions being made at the higher level. Therefore, the direct managers felt disabled to actually influence the management of the staff directly under them. There were no appraisal mechanisms for the healthcare workers. The tools are there, but it's actually not done. We have casual workers who are paid by the Danida grant, and it was often delayed more than 6 months due to delays in maybe receiving the Danida funds. There were no community health workers on the government payroll. However, we had the community health officers, and all the above contributed to low staff morale among the healthcare workers in Mandera. So what we recommend to remedy the situation, we need to constitute a team to advise on human resource staff needs and give recommendations for quick redistribution of available staff members, pending planning and budgeting for recruitment of staff. There is need for recruitment, but let's first do what we can right now and look at the workload and redistribute. We need to conduct an assessment of facility inpatient and outpatient workload and use this then to determine the redistribution of staff. We need to finalize, launch, and disseminate and implement the manuals developed by the County Public Service Board, that is the training guidelines, HR manual, internship policy, and disciplinary guidelines. So the Public Service Board has actually already developed these guidelines, it's just that they are not yet launched or in use, and implementing this would actually solve many of the problems that we found in terms of human resource. We need to disband and appoint a new Human Resource Advisory Committee and implement the disciplinary guidelines developed by the County Public Service Board in a transparent manner through a newly appointed advisory committee, and also so that the staff can feel that it's a fresh start. We need to prioritize recruitment for primary health level facilities, focusing on the nurses, lab technologists, clinical officers, using the workload indicator as service model. So these were the largest gaps: the nurses, lab technologists, and clinical officers at the primary level. We need to adapt and use the human resource information system to manage staff so that at any time you're aware of the number of staff you have, where they are, who is on leave, who is on active duty, who is on training. It will also help to guide how we plan our training so that you don't release so many healthcare workers for training and you're left with shortages at the facility. We need the promotion of specialists and all cadres to be guided by the county HR norms so that there is transparency and fairness in the process. We need to employ the 4 key specialists at Mandera County Referral Hospital. Currently, there is no pediatrician, and so if we have these 4, then the county can pursue Mandera County Referral registration to make it an internship center and training center. This would increase the staff available even to serve the patients. enhance staff morale through regular review of staff promotions, performance-based reward systems, and provision of comprehensive medical insurance schemes, which was a major issue. And then regularize the employment and payment of casual workers. Health information systems and research was the last pillar that we looked at. So the existing human resource for health information systems was insufficient to manage data entry, data reviews, and data quality audits and promote the use of data for decision making. So the HIS system was almost entirely manual without a clear costed plan for digitization. There were no EMRs in any of the facilities. The health information unit lacks costed monitoring and evaluation plan and a dedicated budget to M&D. There was no demand and use for data. So the people in the M&D unit felt even if the little data that was generated was actually not used for decision making. Annual work planning process was ad hoc and only developed to meet the donor requirements. Therefore, annual work plans were generated, but it was not coming from the community, facilities, sub-county and county level. One was generated and shared to the teams, and the budget was not determined by the annual work plan or performance review that was done. The health research was not given priority and not funded from the health budget. Therefore, the recommendations are to reevaluate the number, capacity and distribution of the health records information officers in the county and conduct a skills assessment to identify officers who can form the county M&D unit to coordinate HIS M&D activities and also the research activities. There is the KHIS Virtual Academy online. So this is a platform through which we can virtually learn about how to use the Kenya Health Information System, how to enter data, how to retrieve data, how to assess the quality of data. This is an online learning process. We don't need money. So we can identify staff to actually train there. Draw a plan for use of the EMR systems, starting from Mandera County referral hospitals. In order for us to implement EMR, we can't say we'll do it in all 112 facilities. Let us start from the county referral hospital, working our way downwards to the sub-county hospital. Then when we have that institutionalized well, then we can go to the lower level facilities. Invest in internet connectivity, computers, recurrent funding for airtime and training for all staff of EMR. Investment in this internet connectivity and even computers will still help us in improving our NHIF uptake and reimbursement mechanisms. Allocate 5% of the health budget to health information, including M&D and research, and let's build capacity. For research, allocate specific roles and fund the unit so that we can use research to improve our healthcare delivery. These are the members of the task force who we worked together to come up with this report. We are thankful for the opportunity to do this work and present this to you. Thank you.
Thank you very much. His Excellency the Governor, I cannot thank you enough for giving us the opportunity to do this with and for Mandera. Next month will be the 50th year since I entered the medical school, University of Nairobi, in 1973. So 50 years later, having seen what's happening here, having worked across the World Bank and everywhere else, I can tell you with confidence that the report we are giving you is a standard report that you can take anywhere in the world and it will be approved. But first of all, let's remove some myths. There's a myth that Mandera is an unsafe and insecure place. This is wrong. Only one county in Mandera, Lafe, is insecure. Sub-county. The rest of them are as secure as Siaya. But because we want to use that word insecurity, it has made it possible for health workers to be absent from work, for health managers to be unaccountable because of insecurity. This is hurting us. Maybe you are enjoying being called insecure, but it's time that you made the rest of the country know that the whole county is not insecure. Secondly, the myth that Mandera is poor. Mandera is not poor. And we have looked at that in terms of NHIF coverage. And we see clearly that at 1 goat per year, every household in Mandera can be on NHIF. 1 goat. As we came from the airport, I was counting the number of goats that were roaming by the road. And I've also been following the news on the number of goats that died during drought. And I can assure you that had those goats been taken to KMC, to Nairobi, everybody in Mandera would be under NHIF with no extra money from anywhere else. So you can do it, but do it imaginatively. 4 lessons. Number 1, you are not going to go anywhere unless you focus on primary health care. Prevent, prevent, prevent. Your focus on facilities, I can understand from where you came from, but that is pure hardware. The facilities must work. So the software needs to be done there. So you have to turn your budget around with the support of the politicians so that we go to prevention mode and limit the number of people who require hospitals and referrals. Right now, your expenditure and effort in that area is null. You can build as many hospitals as you want, but your people will not be healthier. 2 is on governance. So, when you ask me to lead this team, I ask you one thing only. Number 1, will you implement the recommendations? And number 2, will you give me honest people? The health sector in Africa suffers not because there is no money, but because it is filled with dishonest men and women. If you want to change this, bring people who have missionary zeal in this sector, who see every sick child as their child, every sick woman as their sister, every old man as their father. We cannot continue being rich on the back of sick people. And this will mean that you need the support of all your people here so that they don't ask you to employ relatives. Put people because they're skilled, they are determined to make a difference, and Mandera will change within 1 year. So governance then becomes an important part of the start of this journey, that you will be different, you will be accountable, and you will be answerable to the people. And unfortunately or fortunately, we realize that being a Muslim society, you have already made audience through the mosques. The mosque can be a discussion point, a reporting point in what's happening in the next health center. The mosque can be a discussion area for the health management teams that are supposed to deliver in that area. Let us use this even as the area for mobilizing people for NHIF. Because if a mosque has people who are not on NHIF, then their people are going to give you problems. Let's use it this time for the health of our people. Comes the area of infrastructure. We saw it today, and Madam Waziri, you are asking common sense questions. We do agree that Mandera was left behind the rest of the country and you need infrastructure. But the most important thing is that it is not just the brick and mortar or the machines, it is the services that they offer. So unfinished facilities are an unnecessary burden on the people. So let us put a moratorium on building new ones. My dear MPs, please, I plead with you. I know that it drives votes when a new one is started and a foundation is built. But that foundation is not healthcare. Let us finish the ones that we have. We have already calculated that if all your facilities that you have already started structuring were finished, you would immediately qualify in the WHO definition of adequate primary healthcare facilities because they are within 5 kilometers of everybody. Just finish them and let them work. The same thing goes with the machinery, the labs, and everything else. You'll be surprised that the only fully functioning equipment, imaging equipment in Mandera is a CT scan. And the CT scan was bought through the medical equipment scheme that guarantees its functionality and its service. The rest of them that you have bought are down and doing nothing. So they are not serving the people of Mandera. So the equipment maintenance in modern health starts with procurement. It is not a question of employing engineers and technicians, because the modern equipment do not require a nyundo and a spanner and a pliers. It is electronic. So when I went to your biomedical unit, I said, close this place immediately because it can only spoil your machines. Your purchase must guarantee service of that machine. So buy service. Stop buying hardware. Buy the service so that it works, and you will be surprised at what changes. In the area of human resource, it has been said to you, we saw it everywhere, and you know it. There's too much of people who are employed not because they deliver, but because they know so and so. This is an African problem. But Mandera, for goodness sake, stop being African for once and just put the right people to do things. When you refer yourself to India to go and be treated there, you don't look for your relative there. Anybody qualified will treat you. So how come when you're home here, you want your relative who will kill you to be the one who is employed without qualification? So let's change this thing, because it's a culture that is killing us, killing our people, killing our children. And that is where human resource is. Madam Waziri, you asked about specialists. And we were told that they've been advertising and nobody comes. Yes, nobody will come. But we need innovative approach to this. Consultants don't have to be employed on a full-time salary, housing, and everything when they sit here for only 1 week and then they are away. Contract groups of consultants, 6 gynecologists covering here. Each month, one of them is here. That group contract will give you more than putting somebody here on pension and everything else, and yet they don't come to work. So change this. So consultants go on contract and save some money to pay the nurse and the medical officer and the clinician better. Right now you're paying people who come and go. If you work with the public-private sector, you'll be surprised at how easy it is to have consultancy coverage here. I'll give you an example. Right now, all your orthopedic patients go across the border to Ethiopia. But where do they go to? To a mission hospital. They don't go to a public hospital because that mission hospital has kept somebody there. Why can't you have a mission or a private hospital keeping somebody here, and you arrange so that they cover both public and private at an agreed rate? Those things can be done. And finally, 2 areas. Pharmaceuticals, you've had it. 700% higher purchase. Can you think, do you think that you can buy enough medicines for the people of Mandera? Absolutely none. And why is it that KEMSA is not giving you? It's not just because of KEMSA. You always send your request late, or you send too small, so that an opportunity comes for emergency purchase at 700%. So these are things that we must do and do correct for our people. This is not about me or you. It is about our people. IT and information. You saw the title of this document. It is identify, reach, and serve with dignity. It's only in Africa where we never make an effort to identify our people and our patients. We always work on estimates of people. The mosque knows their numbers, but the health sector doesn't know. They know the people who die and we bury them, but the health sector doesn't know. It is time now where Kenya is moving that we know every household under that mosque. And that household has a number, has a name, and it can be reached. Once you reach it, you can provide service for it. Once you provide service for it, you can bring in the result framework that shows whether they were immunized, they were fed, they were given the injection. That requires that we use IT. Now, there is not a single health facility that has functional IT system in Mandera. And yet, when I go to Nairobi around Jamia Mosque, all the computers there are owned by people from Mandera. So how come you can stock this thing in your shops in Nairobi, but you can't bring them to your hospitals here? I believe we can, I believe we must, and that is why my team is proud to give you a report that has all the details and all the evidence of the things that we have summarized. We appreciate you and we are honored by the opportunity to do this. Thank you very much.
Let's recognize the efforts of the task force. I know Prof is a lecturer. You can stand and give us health the whole day without us getting bored. And may I now request the entire audience to appreciate what has been done by this task force. I think that is kidogo sana. Can we give them a kilo clap? Thank you very much. Thank you very much. I know for my team, we have heard what the task force has said and the government. There's a reason for forming it. When you find yourself 50 years behind and catching up, we are somewhere that is not entire doom and gloom. And when you are criticized, this is where we Africans usually sometimes go back to our skins. When you are criticized, you take criticism in your stride and change positive. We take that positive aspect of the criticism, and in no way shall we feel that any part of us has been hurt. Thank you very much. May I now hand over to the County Secretary for the second part of the program.
Thank you, Chairman, and the team for that wonderful report. Your Excellency, the Governor, the Honorable Susan, the Cabinet Secretary for Health, all protocol observed. I want to take this opportunity to thank the task force members, as well as His Excellency the Governor, for starting with the healthcare and followed by education. So without wasting much time, let me invite Honorable Ahmed Rashid, the Majority Leader for 3rd Mandera County Assembly, to make his remarks.
Thank you, Madam County Secretary, Your Excellency the Governor, the CS Cabinet Secretary for Health, the members of National Assembly present, my colleagues and other security team around, led by the County Commissioner. I'll be very brief in my comments because I know the team is supposed to go back to leave, and I'm sure you still have a lot to do. But mine, on behalf of the Mandera County Assembly, I would like to thank His Excellency the Governor for, first of all, forming this very important task force that has actually told us where we are. And they have told us the way it is. And Professor, we thank you so much on behalf of the County Assembly. And I really like the two questions you have asked His Excellency the Governor before you took up that assignment. Are you going to use this report that we are going to give you? And also, you also told him, give me honest people who are going to tell you what you are and how you are. And I'm sure from the information that you have given us here, His Excellency the Governor has opened the server for you, using the word that is currently being used, for you to access every corner of this county and interact with everybody so that we are able to give us the information that you have given us today. And I'm sure we have a lot of lessons to learn and issues to change, to reinvent actually, to change the way things are being done so that we are able to make use of the resources that we have. And you said, you rightly put it, we are not short of resources. We have enough human capital. I've seen here numbers that have increased from I don't know how many to 1,200 plus personnel serving the healthcare. That is quite a huge number of people. And the problem is, I'm sure, is just a systemic disconnect that we are having. And I'm sure once we improve what we have given us, I'm sure the healthcare provision, service delivery is going to be improved. And I'm being hesitant, but Your Excellency, thank you very much. As you indicated in your manifesto, you have said that the key areas that we are going to emphasize is education, healthcare provision, food security, and you started with, I think, education task force. And why we have made this task force, in the olden days we used to have a task force that the reports are not being used. I think that's the fear that the professor was having. We have been making task forces after task forces, and those reports are just gathering dust in those offices. But I'm sure with God's help, we can assure you, Professor, that His Excellency the Governor means it, and us as an assembly, we are going to give all the necessary support to ensure that this report is going to see the light of the day and is going to do whatever it was supposed to be doing. So thank you very much. Karibuni Mandera, Madam Waziri, and feel at home. Thank you very much.
Asante sana. Because of time, let's try and be brief. The next speaker I invite is Dr. Ahmed Dakane, the CEO for Kenyatta University Teaching and Referral Hospital. So, Dr. Ahmed.
Assalamu alaikum. Assalamu alaikum once again. Mandera, I'm actually from Garissa, and I'm very impressed. This is my first time to be in Mandera, and I can tell you, you are very far ahead from Garissa and Wajir. Madam CS, Bwana Governor, Deputy Governor. In fact, the Deputy Governor and I are friends. We have lived for many years together in the US, in a state called Minnesota, and we both relocated to come and serve our Kenyans. So it's very good to see you, Bwana Deputy Governor, Dr. Ali. So just really briefly, I want to tell you, my name is Ahmed Dagani. I'm the CEO of Kenyatta University Teaching, Referral and Research Hospital, of course, under the leadership of Madam CS, who is our CS Minister of Health. We are the newest level 6 facility. I'm sure many Kenyans know us for COVID. We have treated majority of the patients who have contracted COVID during the COVID-19 pandemic. And as a result, we have ICU facilities. We have the largest ICU facility in the country. We have 68 ICU beds. But our flagship project is oncology. We have oncology services. We're trying to be the center of excellence for oncology And I'll briefly mention an area that we can perhaps partner with Mandera County. We have signed an MOU, Madam CS, with 10 counties. Perhaps the governor whispered to me that and say that we need to meet. Maybe Mandera can be the 11th county to sign an MOU with KUTRH. So just really briefly, we have an integrated molecular imaging center at KUTRH, and in that we have PET scans. Madam CS, we have served patients who have been brought all the way from Mandera, and in fact, we are receiving patients not just from the country, but from within the country, but we have also served patients from 11 countries so far. We have the largest cyclotron machine in East and Central Africa. In fact, the only machine in East and Central Africa, second to Egypt. Egypt is the only country that has such a facility. And so, but what we are telling Kenyans, and of course the other governors that we have hosted, is that we need the counties to be establishing their own PET CTs instead of clogging the system at KUTRH. So that now as a hospital, because we're able to produce the consumables required for PET CTs, initially the consumables used to come from South Africa and from Egypt. But now that we have those consumables, we are able to support the counties once they establish PET CT. So, Bwana Governor, if Mandera can take up establishing a PET scan, because we are getting patients from here, then as a hospital we're able to facilitate you with the consumables called isotopes to be able to support. And then, of course, other than collaborating in the supplying of isotopes, we can train the healthcare workers who will be operating the PET CTs. We can also partner in telemedicine. You know, of course, one of the areas that Mandera, the Taskforce had asked Mandera to really establish is the use of health management information system. And that's an area that we can also partner through telemedicine. All the specialists don't have to come here, but now that we have a robust technology, we're able to ensure that the specialists that we have at KUTRH are able to communicate with the medical and healthcare workers here in Mandera. And so, Madam CS, when we were in Garissa, you had given us a challenge as far as ensuring that we do medical research, particularly on esophageal cancer. And I'm happy to report to you that we have partnered with a hospital in the UK, and we had done a ground research together, which we had won 450 million to do research on esophageal cancer, which is really positive. I don't want to take much time. We welcome the governor and the deputy to KUTRH so that we can take up the conversations. And it's very nice to see you. Mandera, you are doing a wonderful work, and continue, inshallah, being ahead of Garissa and Wajir. Thank you.
Thank you so much. The next speaker is Dr. Kelly, the CEO for Kenya Medical KMTC.
Okay. Your Excellency, the Governor for Mandera County, our Waziri for Health, Madam Susan Nakumicha, the Deputy Governor for Mandera, Honorable Members of Parliament, Members of County Assembly, the Task Force, ladies and gentlemen, good afternoon to you. Let me give a brief of Kenya Medical Training College and our partnership with Mandera County and where we are and where we want to. Kenya Medical Training College is almost 100 years old, having started in 1927 with 4 students. Currently, the college has over 57,000 students and is in 44 out of the 47 counties. The college offers 93 courses which are registered with Kenya National Qualifications Authority. We have 18 departments which are organized in 7 faculties. Your Excellency and Waziri, KMTC is a state parastatal, and we offer training for human resources for health, meaning that we gear our curricula to address the emerging needs of counties, Mandera being one of those counties. Your Excellency, Mandera campus is almost 4 years old. Come April, it will have had 4 years in existence since it was started in 2019 April. We have one course at the campus that is community health certificate with 50 students and diploma with 22 students. We are currently admitting additional 50 students to do community health. The college is planning together with the county and the regulatory bodies to ensure that in September, if we meet all conditions, we are able to offer enrolled community nursing and also put in place arrangements to have clinical medicine. We are also, Your Excellency, we are also planning that we collaborate with the neighboring countries so that they have admission slots at Mandera campus. Going forward, Your Excellency, the board will be interested in having an MOU with the county to be able to address the emerging human resource needs for the county, particularly the specialist areas that the county has challenges addressing, like pediatric nursing, anesthesia, and reproductive health. We also want to help the county to address primary health care challenges. Thank you so much, and be blessed.
I want to invite Dr. Fatuma, the head of mission for Kenya, IGAD. Let's, Madam, be brief as we hand over the program to the next phase.
Thank you. Honorable Minister for Health, Madam Susan Nakumicha, the Governor, the Deputy Governor, members of the Task Force, members of Parliament, distinguished guests, ladies and gentlemen, all protocols observed, and I don't want to take much of your time. As we all know, IGAD is an 8-member institution, is a regional intergovernmental entity. Kenya is a founding member, and I'm privileged to be here, Governor. Thank you for your invite, and Excellency Minister. It gives me a great pleasure to be here, as said by all the previous colleagues. Just to answer why is IGAD here. As I said, Kenya is a member of IGAD and a founding member for that matter. In the agreement establishing IGAD, the need for countries to work together has been envisioned 37 years ago, and that is why we're here. In line with the same and narrowing down to what we are doing here today, the IGAD, Mandera as a county, before it became a county, it used to be called Mandera District many years back when I was a kid, and by the way, I come from Mandera. Thank you. Mandera Hospital used to serve the neighboring countries way back in the 70s and 80s, as long as I remember. And the fact that Mandera is bearing the pressure from the neighboring countries is what makes it a priority county for IGAD. And in IGAD, we have clustered the crossing points or the borderlands into 7 clusters, and one of them is Mandera cluster. Mandera cluster serves the Ethiopia, Somalia, and the Kenya population and community, and IGAD has established the IGAD Cross-Border Facilitation Office in Kenya. It is hosted by the Kenya government, procedurally under the office of the county commissioner, because we are part of the national government, and the county government is privileged to support us, but we are also privileged to work with the county government. A brief information, Kenya is also hosting several specialized institutions. Kenya is hosting the Center of Excellence for Nutrition under the Ministry of Health. Kenya is hosting the Climate Center under the Ministry of Environment in Ngong. We have the IGAD Center of Excellence for Pastoral and Livestock Development. We have the IGAD Leadership Academy under the Kenya School of Government. We have a similar cross-border facilitation office in Moyale, which is meant for the Moyale crossing or border area, but it is hosted in Kenya. So Kenya is hosting huge number of IGAD specialized institutions. And what does that mean? That means that Kenya has a responsibility to ensure that they support all those programs in health, livestock, climate. They support the neighboring country. And therefore, IGAD has worked with the county government of Mandera. In the last COVID response, we have donated an ambulance, and that has really come in handy. We have supported the county government of Mandera, Moyale, Turkana, and Lamu. We are actually putting up a PCR machine, state-of-the-art PCR machine excellence in Moyale and Lamu. And why are we doing this? We want to ensure that Kenya is able to support the regional integration agenda, but also reduce the pressure that Kenya government and the county government in the border areas are bearing. With those many remarks, we have worked with the National TB program. We've had programs on maternal health. We are working on digital program using data for decision making. We are working on issues on nutrition surveillance and ensuring that cross-border counties are addressed. Honorable Excellencies, and this is out of this discussion, is to bring this to your attention. I know time is not on our side, is that again, in line with the agreement establishing IGAD, IGAD has been tasked to support and facilitate movement of communities across the border, and that we've been requested as a regional government to put up bridges in the crossing points. That is we used to call it Mandera, the Merdan. I don't know which name it is. We have to put up a bridge in that crossing, Malkamari, and another crossing area, and that we are working with the governor. Thank you, Governor, for the positive support. I'm working with the Ethiopia government, and the Ethiopia government has confirmed its support. Somalia, to ensure that we facilitate movement of persons, goods across the county, so that we are able to support and improve the outcomes across the sectors in our community. In addition to that, the establishment of a super reference lab in Mandera. I'm happy to note that there is good infrastructure. We will work with our national government, particularly the Office of the CS, and the other counties to ensure they support this venture. Thank you very much.
Asante sana. At this juncture, I kindly request, it's a kind request, the county commissioner to come and manage the program for the MPs.
Thank you so much. The CS, the Honorable CS, Your Excellency the Governor, all protocols observed, the Honorable Members of Parliament. Mine will be very brief. I just want to invite the Members of Parliament just to say something small, and then from there we proceed with the program. But before I sit down, we must salute the team for one job done. They have done wonders. This report is ours. We are the consumers, all of us. We need to take it very positive. All the sectors, including myself, the security sector, we have to take this report very seriously. The task force has done its work. And Your Excellency the Governor, you are a very brave man for you to allow these guys to dissect your office. It touches on almost all the sectors of the office, whether it is the Department of Finance, whether it is the procurement department or the key sectors. This was quite brave. All of us will need to look at this report seriously. Let us interrogate it, let us scrutinize it thoroughly, and then from there we proceed to the next level. I don't want to say much. Mine is just to salute you. At the same time, I must commend our CS for finding time to come to Mandera. Mandera is a safe county. You are the second CS now to come within a span of less than 1 month. And we highly thank you for finding time to come and officiate the launch of this task force. Thank you so much, all the members. May I now invite the members of Parliament just to say a word to the people, and then from there we approve this. Thank you so much. We will start with the Honourable Member of Parliament for this topic. Patia Makofi.
I think we need to be very serious on protocol. We need to be very serious on protocol. Your time is not yet. It is wrong for him to invite you before us. Yes. Thank you very much, Madam CS, Governor, Deputy Governor, Members of Parliament, CSC's President, Chief Officers, Members of County Assembly, and members of the task force. Before I do mine, Madam CS, this is Mandera Town. And Mandera Town is number 009. Mandera County is number 009. And the facilities you have seen today serves the whole county. And this county is extremely vast. When you see the MTC, this county hospital, you need to know it serves from borders to Wajir, Marsabit, and Somalia, Kenya, and Ethiopia. So this area serves 3 countries. Before I do mine, let me first and foremost invite my colleagues in Parliament. I'll start by the Honorable Suleka, nominated Member of Parliament, to do 1 minute. 1 minute each. Follow protocol.
Thank you, Mheshimiwa Waitan. Madam CS, His Excellency the Governor, all protocol observed. Mine is to start with thanking the Mandera County Government for the warm reception. It was very good and we enjoyed the day. Welcome, Madam Waziri. You've been to the rest of the northern Kenya counties. This is your second or third. We appreciate, and as already has been said, you are the first actually, CS for Health who is coming to Mandera. We appreciate, you are not taking that lightly. On the report of the task force, the chair and the rest of the team, it was excellent. We have been part of the recommendations and the discussions throughout. The recommendation is a good one, and we ask the governor to kindly implement this report. It is a very, very, very important report for the health system of this county to move forward. The last 10 years, we've made tremendous improvement in terms of health. You've seen where we've come from in terms of human resource, the infrastructure, the equipment. We've collected it from a zero ground to where we are today. I'm sure you've gone through all the systems. Madam CS, my humble request, I just noted something. I am not part of the health committee, but I came to know Mandera is not part of those many grants and fundings that the national government has. There are so many grants that other counties are maybe piloting or has been there for many years and we are missing. So my humble request is you look into that issue once you go back and we become part of those beneficiaries. Number two, we've done most of the infrastructures in the county. My request is the only one that has been on my mind. I've been in the county for the last 5 years. I was a CEC roads and then finance. And the one that has been missing is the mental health infrastructure that we don't have, and the most vulnerable people in this county. So tunaomba tafadhali ukirudi prioritize that one and the grants for this great county. We appreciate your support. We welcome you to Mandera once again. Asante sana. Mheshimiwa naliharakisha.
Thank you, Mheshimiwa Suleka. Next is Madam Mariam, our nominated senator.
Assalamu alaikum wa rahmatullahi wa barakatuh. Madam CS, Governor, Deputy Governor, all protocol observed. Thank you, Governor, for this project, this report. In fact, recommendations are supposed to be implemented. And when it comes to positive, this is teamwork. It's not only Governor, CS, Governor, up to casual workers. We're supposed to have intentionally, supposed to service delivery must be done so that our people must benefit with devolutions. Devolution is not supposed to be here, is here now with us. To benefit is up to us. Teamwork. What we miss, our CS, she's here. She can implement. Governor can implement. And also, shop workers, those cleaners, can also do it. So, Professor, we did work. There's a marvelous work. But implementation depends on all of us, MPs, and up to us. The other one is finance, health finance. Last week, I went to NHIF. Linda Mama is only 3,200 and something in the hospital. Does it mean our mothers are not going to hospital? Or our workers, the workers, hospital workers, they are not making claims supposed to be done on time? Because that's money. It's supposed to benefit our people. Because private sectors are getting 90% of the NHIF money compared to public. So, please, our workers on the ground, this is not the work of governor only. Ni sisi yote, and we can. Thank you.
Thank you, Ms. Mariam. Next is the Honorable Member for Lafe, Mohammed Abdikir. Mohammed Abdirahman.
Our chief guest, Madam CS, our governor, the deputy governor, county commissioner, members of parliament, our task force members, members of county assembly, the executive from Mandera County. Assalamu alaikum wa rahmatullahi wa barakatuh. It is a great honor for us to be here today. We are really very happy to join the governor and Madam CS to launch this task force report. I want to take this opportunity to thank His Excellency the Governor for coming up with this idea. and also our task force. They have taken their work serious, and they have taken the shortest time possible to deliver this report. We are grateful, Professor and his team. Lakini wakati umesema Lefe is insecure, when you have said that at least the notion Mandera is insecure, I was expecting you at least you have covered all Mandera, but when you have singled out Lefe, but I want to tell you, and I'm grateful your team have visited Lefe despite have been told that it is insecurity, but they have visited the area and they have taken the report, so we are grateful. And the notion is still the same. Those who are saying Mandera is insecure, they are the ones who are saying Lefe is insecure. So Lefe is secure, your team have visited, and that we have our county commissioner here, he can attest to that. That was a light note. Really, much has been said by the people that we have tasked to do the report, and now it is up to the Mandera county government to implement that report. I'm sure we have a very competent team who can deliver this once the leadership has the honest to do this, and the governor has already proven that he wants to deliver on this. Madam CS, despite being all this challenge, it is only Mandera County, in this Republic of Kenya, it is only Mandera County where you find education is free. Secondary schools in Mandera County, we have over 53 secondary schools in Mandera County. All have been catered by the courtesy of the governor, Mandera County. The parents were very happy. They have not paid a single coin to pay for school fees. So now that he has taken that task, we also have a good faith, and I am sure he will deliver in this report of health. In 1 year's time, I am sure he will call us here, and again he will brief how he has implemented this, and he is up to task. We are very grateful on that. Madam CS, when we visited at the KMTC in Mandera, you have been told the challenges that they are facing. The county government have did their part. Also the national government, they did their part, but there are some still small thing that is remaining. I sit in the budget committee. In the just concluded supplementary budget, we have allocated 300 million for KMTCs, though 215 was for specific KMTC centers, but we had 85 million that was kept aside for across the country. So what they were asking is little, it's only 20-something million. I think you can help us on that 85 million. The other issue that actually the task force have talked about is the issue of decentralization of the functions. One of the reasons why the departments are not working is because all the counties, this cut across all the counties, the issue of finance is only domiciled in the treasury. So we want also to urge His Excellency the Governor to at least make sure that each chief officer should account for his money that is allocated for, and they should, if they are given the opportunity to account for it and at least to deliver, they will deliver their work so kindly. And the other issue is coordination. Where we have a problem, Your Excellency, is a coordination. At the sub-county levels, we have each department an officer that at least is representing the sub-counties, the department. You know, initially, it is required that they report through the sub-county administrators. That's why we have in every sub-county a sub-county administrator, and at the ward level we have a ward administrator. So if we allow those the report to channel through those offices, I think implementation will be easy for the department to do their work. With those few remarks, thank you very much.
Thank you. Mheshimiwa Korre, Mheshimiwa Abdul Haro wa Mandera South.
Your Excellency the CS, Your Excellency the Governor, all leaders, all protocols observed. I will take the shortest time and I would say many thanks to the task force for the reports, the in-depth reports, and the recommendations that you have presented to us here today. Basically, we could identify with the report. Much of what you have said are things when we sit in our small tea cafes, we could discuss and argue about them. And now that you have put in brains and effort to give a meaning to those tea place talks, it's a very useful thing. So one thing I think we take home, the fact that Mandera healthcare is reimagined, that we are going to identify the households, reach them and serve them with dignity. Already that one is super class for me. The fact that you even put the word dignity there is super class. The other thing is the emphasis that the report has on primary health care. Prevention, Professor, you said prevention, prevention, prevention is another super class for us as people from Mandera. And then of course the elephant in the room, the governance. The whole spectrum about the governance of the health sector, as you have dissected and pointed out it's a voluminous report. I'm sure as a county we will discuss and debate about it internally after you guys have left, but those are very key issues. Finally, I would say we thank you for the report and we thank the Governor, His Excellency Mark, for, to December, mark the mark. Did we mark the mark? Yes. So we didn't mark the mark in vain. The fact that he's decided he will put together this team to look at what is ailing the health sector in Mandera County is a feat of intelligence, and we thank you, Your Excellency, for even thinking about that. So this is a journey. I think the history of the healthcare in this country since independence has been a long journey, filled with a lot of valleys, mountains, rivers to cross, and a lot of challenges, and it's not all gloom. There are also spits of successes and things that we could take pride in and say, well, this has happened. I remember in the first term of devolution, when the first cesarean section was done in Takaba, referral, is it a referral hospital? It was something we celebrated not just in Kenya but the world over, because it was a first for us as Mandera County, and perhaps a first for us in Northeastern, and perhaps a first for us in Northern Kenya, and we took pride. So it's not doom and gloom. There are also spots of successes and things we can take pride in as a county, as a country, as a region, and as a people. So it's a long journey. We've reached where we've reached. And thank you, the task force, Professor, and your team for helping us identify some of those things. Your Excellency, as a Member of Parliament for Mandera South, and I'm sure on behalf of my colleagues, for those perhaps who don't know, with your permission, I'm also the chairman of the caucus of the MPs for Mandera County. So that's another cap on my, on my head. But I am now the host of my worthy colleague, Honorable Hussein Waitan, whom I respect a lot, and we are in his constituency, and we are his neighbors when we are here. So it's a journey. We have reached where we've reached. Asante, Professor, with your team for helping us identify those things. Your Excellency the Governor, personally, and my constituency, and on behalf of all those people who listen to Kore, we will give support to this report 100%. Thank you.
Thank you, Mheshimiwa Kore. Mama County, Mheshimiwa Khair Qasim.
Assalamu alaikum wa rahmatullahi wa barakatuh. Madam CS, Governor, Deputy Governor, all leaders, all protocols observed. Karibu sana Mandera, Madam. Thank you, Professor and team, for the good work. I listened to you some time back, a month and a half ago, and I'm glad that we have the report launched. Congratulations, Governor. It isn't easy for someone to think about what is ailing our healthcare. You started with the education sector, now this. I know that you will implement, and with our support, Mandera healthcare will be better than we are in now. On healthcare systems strengthening, you've mentioned on the 6 building blocks. I know we are ailing in all, but I just want to mention one on the health information systems. Our health information system is manual. It's actually not functional at all, because we know Mandera had the highest, or still has the highest maternal mortality, but the data capture is very poor. We can never tell exactly how much we are losing, but we are losing lives. Apart from maternal deaths and child deaths, I'm more keen on disability and healthcare, how best we can integrate. And I just wanted that to be enhanced more in your report, because we cannot ignore the fact that we get children who are disabled. Not physical disability, but even mental disability. Now that mental disability, if the data is well captured, it will inform on how best we plan for their education. Prof, I remember in our last meeting you mentioned on the interconnectivity of all these sectors, from education, health, and agriculture, because of the food security part, social services. But what I really wanted to hear more is how best, because Mandera, Madam CS, unfortunately, you may not be the education CS, but you know health now encompasses everything. When you are well educated, then your health, of course, definitely improves. The motto was identify and reach every household, something dignified every household. Now that is where disability comes in. We have children who are locked up in houses, who have no access to education because it's not documented at birth, and there's no way now the education sector will use that data to trace and ensure that they go back to school. With the help of Allah, I want to ensure that the disability school that was started a few years ago becomes a success at the end of my 5th term. And for me to get that, Honorable Governor, is for us to work together so that we identify and make the school a referral school from the whole county, same way we have referral hospitals, so that we have boarding facilities. I think that is where our interrelationship will come, so that we see how best you improve on that, and how best as the area MP and I can work on that. The other one, Prof, is on community ownership. We know schools have parent-teachers association, BOM, but in health sector we do not have that. So the sector working group now should make sure that the ulamas, the sheikhs, and the community elders have, because we need to focus more on preventive rather than curative, because it's more expensive. Of course, when we have issues about health discussed in the mosques, in the marketplaces, and even in our workspaces, then our general health improves. So I'm really keen on that interconnectivity. The other one is on the workforce. Workforce is mentality. We have structures, as said, but Governor, I assure you that we will not condone people who do not want to work. If you do not feel like working, you rather leave the county, allow others to work, so that we get service delivery and work for our people. Thank you very much.
Thank you, Mo. Mheshimiwa Kulo wa Banisa.
Assalamu alaikum. CS Health, Madam Susan, our Governor, Mandera County, His Excellency Muhammad Adan Khalif, the Chair of the Task Force, Dr. Rongo, Members of Parliament, our Deputy Governor, all protocol observed. Assalamu alaikum. I want to start thanking our CS for giving us today this time and opportunity to be with us here on the launch of this task force report here today. Equally, I want to thank the task force headed by Dr. Rongo for giving us an elaborate and comprehensive report, and I'm sure we are up to the task, and the Governor is up to task, and ensure that this report will not be shelved like all other reports in Kenya. You know, Kenyans, we are known for coming up with task force commissions, and these reports, the reports of these commissions end up in the shelves and not being implemented. But it is my prayer, the way even the chairman of the task force has said, this task force report will be implemented. I know we are still very far behind in terms of health. If we look at even the SDGs of the world, the goal of the Sustainable Development Goals of health, goal number 3, where it talks of ensuring healthy life and promoting well-being for all at all age. Have we already reached anything? The mortality level, the maternal mortality goal for SDG is 70 per 1,000 households. But in Kenya or in Mandera, we had how many? 370. We're still far behind, but with the implementation of this report, I'm sure we shall reach that level, at least the level of the rest. The other thing I want to urge the Governor, as he has initiated this special task force on health, this county has a lot of other problems. Let him also start task force on human, that is resource, task force on capital resource equally. We have billions of burning bills. We must do forensic audit, have reports on the same, because we cannot only touch one sector and leave other sector. We must do a comprehensive reports on all sectors of this county, so that we can have very good working report. So mine is to urge the Governor, the way you have started on education and health, move to human resource, move to the capital resource, where we have billions of burning bills, so that we can start this county from a point of vintage, from a point where we can say we can do equality and equity to every part of the county. Lastly, in the report, it is indicated that we have a lot of infrastructure, but looking at what you gave us as a report, I come from Banisa. The two areas where we have a lot of problem in terms of even infrastructure is Lafe and Banisa. So despite the fact that we have recommendation here not to build, to put us at the par with the rest, Lafe and Banessa must also be considered also. Thank you very much. Wish you the best. And thank you.
Thank you very much, Kulo. Next is our chairman wa cohesion, Mheshimiwa Adan Haji wa Mandera West. Some of the things mentioned, he is the chairman.
Madam CS, His Excellency, our Governor, His Deputy, Bwana County Commissioner, all politicians from the local level to the national to international levels, wazee wa mji, ladies and gentlemen, assalamu alaikum wa rahmatullahi wa barakatuh. Well, you know, when we are given the mic after all these people have talked, there is nothing new to talk. And there is no need of repeating what others have said. But first and foremost, I think I must sincerely thank this task force headed by the chair here for the excellent job done. When the governor appointed the task force, me and some others who are taking some tea somewhere in Nairobi were saying, Kwani Governor hajui kitu gani natakana afanyike? Why is he coming up with task force and task force? Now I know. Now I know. If I say one or two things about the task force, what we need to do is to operationalize those recommendations. They are very good. They are excellent. They are doable. Can we take lead? Mwana Governor, we are with you. And make sure we operationalize those recommendations. Where the task force talked about formation of advisory committee, I think this is an excellent input or advice. We need to have an advisory committee that can advise us. People of the caliber of the sort of the persons of the task force that we have. The task force insisted or stressed so hard on primary health care, prevention, prevention, prevention. This is where I come in now. When we talk of prevention in the health sector, we need to look at food security and nutrition. I, being the chairman of the Eastern African Parliamentary Alliance on Food Security and Nutrition of 11 countries of Africa, this is where we need to focus. I think our next task force should be food security and nutrition. Because with good food, you prevent a lot of diseases. With good food, there is dignity, complete dignity. With good food, people are happy. I know you have passed through a very serious drought, and that is an area where we are seriously affected by the drought, food security and nutrition. Mr. Governor, I as the chairman of the Eastern Africa, I am very ready to help your government in terms of leveraging some resources from Eastern Africa. I'm going to the King of Lesotho tomorrow on the same issue where all African heads will be meeting to discuss on this food security. Let that be our next great agenda. You have done excellent in the education sector. Every Kenyan, when we are in parliament, other parliamentarians are asking us how can, what magic did your government do to pay secondary school fees for everybody? We told him there is no magic, it's a matter of goodwill. So we have done that, we have done the education. For health, as soon as we implement what has been recommended here, we are good to go. The next thing should be food security and nutrition, which is partly health, partly integrity of our people. Finally, the governance issue. I think this is where we have a big problem, to be very frank. In this, what do you call, devolved system, before devolution we used to say we are marginalized. We can no longer say we are marginalized because we have our own government here, we have our own resources, billions of shillings, we can no longer talk of marginalized. But we marginalize ourselves by poor governance within our systems, within our departments, within our sagas. Can we look at our governance system very critically? I hear of today as we are moving in the hospital, I hear some old health workers saying that I have been here for 32 years and I was a sector head, and the day first day somebody who is 3 years old in the service was made my director. I'm demoralized. They don't tell you these things, but they tell us. You know, they are our employers. If we don't listen to them, they'll fire us. So, let's look at the governance. It is state by state, department by department, saga by saga, and every sector of ours. With those few remarks, I once again sincerely thank the governor for thinking out of the box and coming up with this task, and the task force for giving us very, very, very healthy recommendations that if we implement, I'm sure we shall be different from what we were. Thank you so much.
Thank you, Mheshimiwa Adan Haji. You know, I could not come near him because he can be my father. I was avoiding him. Mheshimiwa Major Retired Bashir Haji Abdullahi is the chairman of Pastoralist Parliamentary Group with a membership of 105 members in Parliament. So if those members want to remove a CS, it is just a day's job. So some of you must be very careful.
Thank you, Honourable Member, but Madam Waziri, don't get worried. Yes. Our chief guest, Madam Waziri, our governor, our deputy governor, county commissioner, the task force present, led by Professor Robo, county assembly members, senior executive of the county, members of the health team, and the community of Mandera County. Assalamu alaikum. And when you know everybody speaks, you only say identify with what everybody has said. So I will not take long, but mine is very brief. First, I want to thank the governor. It takes a lot of courage and bold to really say, please come and interrogate my bedroom. So that boldness means you want to deliver. And thank you very much. Thank you, the team led by Professor Rogo, for doing a wonderful report. I know the report is too big. What you gave us is a summary, an executive summary sort of. We will interrogate the entire report as well. But one thing I assure you, just like my colleagues have said, we will support that report 100%. I will still want to ask what Professor Rogo has asked the governor, will you implement? Now, as members of parliament, we will still ask you, will you implement? One year down the line, we will take you to task to ask whether this has been implemented. But some of the things actually were things that it's my first time to interrogate or sit down with the team here. Informally, myself and the governor discussed the issue of health centers and dispensaries. I didn't know the report about what I was talking about, but I told him, and he agreed. I told him, don't build any new structures. For one reason, operationalize the existing ones. Why do you build and the next one is not even operational? I think as members of parliament, as members of this county, let us ensure that what is existing first is fully operationalized. You have hardware, there's no software. So we will support you on that. Don't build. Do what you need to do to operationalize. You have done so well in the education sector. Now we have the health sector. And I'm sure the next one that you need to focus on after this is the issue of agriculture and food security. We have the river here, the riverine, and that is the next focus. I'm sure you will also equally do something good.
My sister here has very good plans for the issue of food security. My team, that is the Pastoral Parliamentary Good Leadership, and her team had a discussion on a retreat in Mombasa just 3 days ago. And these are things we discussed with IGAD. And so many things are going to come to Mandera Belt. And I'm sure with the support of the county government, ourselves, things will be done. So yangu ni kusema, asante. The thing that finished was service with dignity. Our people need this service with dignity. That is the only thing that we need. We will support you. So yangu ni kusema, asante Madam Waziri. Welcome to Mandera County. Feel free. I'm told you are the first one that has graced this place since devolution started. So that is also a plus for you. We will also talk to the president, tell him, look, Waziri came and is the first one that has ever graced here. So nikusema asante sana. Let's support the governor. Let's support his team. And I have an apology from my party leader, who's also the senator for Mandera County, angejoin sisi, but he is not able to join us. But amesema amewasalamia watu wote wa Mandera. Remember, he's also the party leader of UDM. I'm equally the deputy party leader of that party. After Kenya Kwanza, we have UDM also here. So the manifesto that the governor is launching is a manifesto that we all agree during our campaigns. And we tell you, Heko, and we support you. Thank you very much.
Thank you, Major. Sorry, Madam CS, our governor, deputy governor, and all others. You know, we are very many. Mandera County have, I think, the highest members of parliament this time round. We have 6 elected, a woman rep, a senator elected, a senator nominated, 2 nominated members of parliament. You can understand that. So there are only 2 that are not here today. Our elected senator, who is not here, and 1 nominated member of parliament. So you can understand that this CS has been valued very highly. The rating was very high. It is not easy to bring all these members of parliament together. I think this is the only function that almost 99% are here. Even the one we were launching the bursary, we were almost 3 that are here now were not there. So take yourself very high, and when you go back, you boost of that. Number 2, one thing I would like to tell you, I'll try to summarize it in 2 minutes because we have taken too long. The KMTC that we were there in the morning, I was supposed to be coming to your office next week because there are so many critical issues, including the transport. That place is 12 kilometers away from Mandera town. They have no bus, they have no any other vehicle. Now the staff plus the student are really suffering. Maybe I'll get it in written form so that we can at least have a solution for that. The staff houses are not there. We need a borehole for that school. We need a borehole. The river is not far from there, but we need to have a solution for that one. The college fees, which most of our students rely on animals to pay fees, and you know, drought has really caused a lot of problems and people lost their livelihood. So we need to have a way that we can have, you know, these fees scattered for. As much as I try mine, I'll be launching my bursary tomorrow, and I'll take care of at least a certain percentage, but the other percentage need to be done by the ministry and the county government. The county government headed by my friend, His Excellency, the governor, there are 8 staff, teaching staff or lecturers in that college that are still working with the county government. They need to be released so that they can be a full-time lecturers in that college. The other thing is hostel, male hostel. We need to construct a male hostel so that, you know, these people can have where to spend. The other thing, coming back to this task force report, Professor, I salute you. Thank you very much for coming up with a very brilliant report. We will support this, and I'm sure the governor has all the energy and all the willingness to support this. If we have done the bursary, I'm sure this one will be even easier than the bursary one. You know, as clearly put by my friend Adan Haji, in parliament, we normally boost as members of parliament from Mandera, because this is the only county that has implemented full bursary for the whole county. You see, that itself is not an easy thing. And this one, I know it will follow, followed by the food security, as put by my Adan Haji, my close colleague. We will also have NHIFs, which I will be also, inshallah, launching tomorrow, so that at least partly, I know that can also serve in a way around 2,500 families, and the county will have, I know, their own program. Thank you very much. We are happy. We expect to implement this. We will have to support this fully so that it can be implemented, inshallah. This is a county that is a working county with all its MPs, senators, women reps, MCS, you understand? We are all here. So we have no enemies. We don't have any differences in our politics. We are all in one line. The politics, we kept it aside. We are waiting 2027, inshallah. Thank you very much. Welcome, Madam CS. Welcome to Mandera. This is Mandera County Headquarters, and this is the MP for Mandera County Headquarters. Thank you very much. Welcome.
Thank you so much. Tupigie waheshimiwa makofi. Asanteni sana. Mheshimiwa Waitan, we did not break any protocol. It was prearranged between myself and the CS. Can I now welcome our Deputy Governor, His Excellency Dr. Ali, to make his remarks. Tumukaribisha na makofi.
Okay. Bismillah. Assalamu alaikum warahmatullahi wabarakatuh. Cabinet Secretary, Madam Nagumisha Susan Wafula. I think many of us could not pronounce it very well, so we had to practice. You'll forgive us. His Excellency the Governor, Mohammed Adnan Ghalif of Mandera County, County Commissioner, members of National Assembly, members of the Local Assembly, my good friend Dr. Ahmed of KU2RH, Dr. Fatuma Igad, I don't know if I'm forgetting anybody, but of course the professor and his team. I say Assalamu alaikum again. I think we've said a lot of things, and I don't think that it's necessary to repeat. But I must say that, first of all, I want to thank Madam CS for honoring and accepting the request of His Excellency the Governor to launch and grace this event. When you are here, it tells us how important it is to you as a representative of the national government, this health reform that we are launching here today. I also must thank Professor Rogo and his team. You know, many people don't know the Professor Rogo and the team members because we are thinking we just picked a few health professionals here and there. Let me tell you, Professor Rogo is a towering figure in the universe of healthcare, both locally and globally, and there's a reason why we picked him to chair this team. That I want you guys to give us a very serious applause. Also, the gentlemen and the ladies that work with him, Dr. Janet, Dr. Bashir, Dr. Dabar, and Aimoy, and many of you are people who were extremely vetted before we decided that this will be the team that will be making this reform. So it is not an easily found report, an easily found team. These are very serious professionals recognized across the country and globally. And I know that, as he said himself, that this is a standard health reform that could be used anywhere in the world. And I believe that because I know the kind of quality and professionalism that they have brought to us. But I must say also that we are in unprecedented times and challenges. A lot of things are changing so fast. You know, the demographics are changing. Technology is changing. Many things are changing. And therefore, we have no option as a government to change in a commensurate measure with things that are changing. And that's why we decided that this is the time to do the health reform. When His Excellency and myself came in on August 8th, we sold a manifesto to the people of Mandera that had certain milestones to accomplish. Within 2 months, 8th of August, 8th of October, His Excellency has announced the formation of a health task force. 2 months. And that tells you how important health reform is for us as the government of Mandera County. To that, I really will look forward to your support. We equally have a number of check boxes to make, including there is another one ongoing, which is education health reform, and then there is another one that's going to be coming, as my brother MP Tagaba has already mentioned. So we have many, many things coming, and I believe our term is up to the task. But Professor, I also come from the healthcare background myself, and I have worked, as mentioned by my brother Ahmed, the CEO. Both of us actually worked in 2 large hospitals that were neighboring. We've worked in a system, healthcare system that works. And really, when you say, let us not be Africans, I can understand and feel your frustration. I know that's not what you literally mean, because we are Africans anyway, but you are saying, let us work and change the way in which we deliver our services. Now, for those of you who don't understand what universal health care and primary care means, there are only 3 things that you have to think about, because many of you, because you have not had the benefit of practicing as a healthcare professional, is number 1, something called access. Number 2, it's affordability. Number 3 is quality. Now, the question you need to ask when we say primary healthcare, it means, can the mother down there at the village access, that dispensary, that clinic? Can she go there and get service? Then when she goes there, can she afford it? And when she affords it, based on the GOAT system, can she get quality health delivery or quality health service and products? These are the 3 things. And I have seen, as I looked at the presentation, all those things were captured adequately, and I can guarantee you, with the leadership of His Excellency the Governor and deputized by myself, we will make sure that we will go through this step by step to ensure that we capture and implement what we have intended to achieve with this healthcare reform. With those few remarks, I want to now invite His Excellency the Governor, who will then invite our Madam CS Secretary. Your Excellency, karibu sana.
Come forward. Come in. Engage.
Cabinet Secretary, Minister of Health, Dr. Susan, Deputy Governor, His Excellency Dr. Ali, Musa Hayadi, the County Commissioner, Members of Parliament present, Members of County Assembly present, Development Partners present, Health Reform Task Force members present, National and County Government officials present, religious and traditional leaders present, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon. Naona tumechoka. I will be brief. May I take this opportunity to welcome you all to Mandera County, a county of unlimited opportunities and endless possibilities. Thank you for accepting my invitation to this event, despite your busy schedules and commitment. I am honored by the presence of the Cabinet Secretary for Health, Dr. Susan, who will speak to us about the importance of this initiative and what it means for the future of the healthcare in our county and country. Ladies and gentlemen, late last year, I established Health Reform Task Force to address out healthcare system's critical challenges, to move forward on the journey to achieve quality UHC, reviewing our entire health system to establish strengths and weaknesses of our service provisions, and organizational effectiveness was essential. I applaud our healthcare workers, and senior management for their positive attitude towards the task force exercise and openness to its work. I thank all the stakeholders who presented their views to the task force during their visits. I thank Linton Health Access Initiative for sponsoring the design and the publication of the task force report and for their support to the health department over the past few years. I am sure they will continue to lend us their hand as we implement the report's recommendations. I also thank the national government agencies for their support during the exercise. Ladies and gentlemen, since the onset of the revolution, our county has achieved a lot. We have more health care workers and facilities now than before. In addition, many of our young men and women have graduated from colleges in the last 10 years, creating a significant pool for healthcare professionals we can tap into. Despite our noticeable progress in the last 10 years, we have yet to reach the level we deserve and can attain, considering the increased human and financial resources we have had over the previous 10 years. Ladies and gentlemen, we are all aware of the challenges we face as a country: raising healthcare costs, inadequate access to care, health inequities within the country. While we share many of these challenges with the rest of the counties in the country, Mandera, by virtue of its geographical location and the investment in all the sectors by the national government during the first 50 years of our independence, faces unique challenges. The recently released Kenya Demographic Health Survey 2022 have shown the existence health inequities in our country. Let me highlight a few indicators for this meeting. Number one, only 76.4% of women in Mandera receive antenatal care from a skilled provider for most recent birth, compared to a national average of 98%. Only 55% of live births in Mandera were delivered by a skilled provider, compared to a national average of 89%. Only 46% of women in Mandera receive postnatal check during the first 2 days of after live birth, compared to a national average of 73%. And only 29% of children in Mandera aged between 12 to 23 months were fully vaccinated. The percentage of households in Mandera with at least one ITN, that is in insecticide-treated nets, is 15.7%, being the lowest, I think, in the country. The percentage of children in Mandera who slept under ITN the night before the survey was 9%. These are not small challenges and cannot be solved by triggering around the edges. Instead, they require bold and innovative solutions, which precisely what the task force report has recommended. Ladies and gentlemen, Mandera County, as you know, borders two countries, Somalia and Ethiopia. The Mandera Triangle, as it is called, presents both opportunities and challenges for us as a county. The triangle long history of poor healthcare access, because of its distance from the respective capitals and the security challenges, has particularly impacted on our healthcare service provision. The cross-border mobile population are often linked to cross-border disease outbreaks such as chikungunya, dengue fever, Rift Valley fever, and among others. As a county, we bear the burden of healthcare costs for the population on both sides of the border. To drastically improve the low health indicators in our county and reduce the burden of healthcare costs from our neighbors, we need your support, Madam CS. We need support from the national government and the development partners in implementing the task force recommendations and developing necessary health infrastructure to deal with cross-border disease outbreaks. Madam CS, during your visit to one of our health institutions today, I am sure you have witnessed an investment county government of Mandera has made in the health sector, some of which are national government functions. In the absence of the national government investment, we were forced to take up some of these projects, not because we had a lot of funds, but because the investment was necessary. However, as you have witnessed, some of these projects are yet to take effect. Madam Cabinet Secretary, in the light of the unique challenges we face as a county in the historical underinvestment by the national government, I request your ministry and by extension His Excellency the President William Ruto to assist us with the following. Kenya Medical Training College, professionalization of the campus through completion of the men's hostel, equipping of laboratory and computer lab, KMTC bus for students, and posting of the relevant tutors. Organization to train qualified students from the neighboring countries to generate revenue for the college and build capacity of our neighbors' healthcare system. Number 2, KEMRI. The expansion of molecular lab diagnostic capacity at Mandera County Referral Hospital to help us improve our diagnostic capacity and prepare for frequent disease outbreak from the neighboring countries. Mandera County gave 100-acre land to KEMRI for research laboratory to cover human and zoonotic diseases under one healthcare concept. We request that this research laboratory be prioritized for timely diagnosis. The county is ready to do co-funding where need be. Number 3, Mandera Satellite Blood Bank. First of all, I would like to thank you, Madam CS. When I came to your office, one of the evening, I think it was even after 5, and I requested you to officiate on this function, which you really agreed. Number 2, I asked you about the bending blood bank equipment, which has been banned for quite some time. And I can confirm to you 3 days, 4 days later, we received the equipment. Thank you very much for that. We require training of staff drawn from the sub-county under the blood bank satellite, a blood driver vehicle, and additional equipment to make the facility operate at its optimal capacity. Number 4, the task force recommended changing the healthcare narrative from curative to preventive. I therefore commit to actualizing this by adapting the primary healthcare network. We shall invest in the full operationalization of our level 2 and level 3 facilities and established 200 community units. We request your support to make Mandera County a national model. Upgrading one high-volume level 3 hospital to a level 4 facility. Funding for the mental health care unit, which actually the MPs actually talked about it. And designating Mandera County Referral Hospital as an internship center. Ladies and gentlemen, for too long, access to quality healthcare has been unequal in our county, leaving some areas behind. But let me be clear, this is not acceptable. Healthcare is a fundamental right for all citizens, regardless of where they live or their circumstances. It is a basic human need that must be met for us to build a healthy and thriving society. The report shows we have not invested enough
resources in our primary health sector. As you all know, countries with a health system with strong primary health care deliver better health outcomes than those with weak primary health care. This is why we must take action to address these inequities. We must work together as a community to identify the barriers to accessing to quality health and find ways to overcome them. This is not easy. It will not happen overnight. But we must start somewhere, and that somewhere is here today. We must be willing to take bold steps and make difficult choices to achieve health equity in our county. We must engage all the stakeholders, including private healthcare providers, healthcare workers, policy makers, and community members to work collaboratively towards this shared goal. Ladies and gentlemen, the report we are launching today is a result of months of hard work and dedication by a group of medical professionals who have deeply committed to improving the health and the well-being of our citizens. The report presents a roadmap for the future of the healthcare in our county, a blueprint for creating a more efficient, effective, and equitable system. I applaud Professor Amarogo and his team for their excellent work. This important milestone wouldn't have been reached without support and cooperation of our health workers, for which I am very thankful. Ladies and gentlemen, this report is more than just a set of recommendations. It is a call to action, a challenge to all of us to roll up our sleeves and get to work. Because the truth is, we cannot afford to sit back and wait for someone else to fix our healthcare system. We all have a role to play, whether we are policy makers, health worker providers, healthcare workers, patients, or simply concerned citizens. So I urge you all, as you read through this report, to think not only about what needs to be done, but about what you need to do to help. Because the success of this initiative depends not just on quality of recommendation, but on the commitment of all of us to see them through. Ladies and gentlemen, let us be inspired by the courage and the determination of those who have worked hard on this report. Let us be motivated by the knowledge that we can create the healthcare system and work for all of us. And let's be energized by the opportunity to be part of something truly transformative. To our resourceful healthcare workers across the county, rest assured that the implementation of the Taskforce report will make your work easy. You will be provided with the necessary tools of trade and improvement in your work environment, purposeful and fair training opportunities, and the review of promotion for those eligible. I urge you all assembly members to rally behind my call to action by actively participating in the implementation process. I commit to providing the necessary resource to implement the short-term recommendation immediately in the next financial year budget. I call on all development partners and Madam CS to help us mobilize resources to implement the long-term recommendations. In conclusion, I urge you all of us to join hands and commit achieving quality and sustainable healthcare provision in our county. Let us be the change we want to see and create a healthier and more equitable Mandera County for ourselves and future generations. Thank you, and let us begin this journey together. May Allah bless you all. May Allah bless Mandera County, and may Allah bless Kenya as a country. Sasa nataka nichukue fursa hii waanza kushukuru Madam CS mara ya pili, mara ya tatu kwa kukubali kuwa na sisi leo. And I would like to take this opportunity and this honor to welcome Madam Cabinet Secretary, the first Health Cabinet Secretary under devolution who visited the county of Mandera. Karibu sana.
Thank you. We can take our seats. Thank you very much. The Governor, Mandera County, His Excellency Mohammed Adan Khalif, the Deputy Governor, members of Parliament present, and honestly, I'm happy that you all made it. And it is thanks to the Governor's efforts. Asanteni sana. Members of the County Assembly of Mandera, led by your Majority Leader, officials from the County Government of Mandera, my colleagues from the Ministry, and especially those from KTTA, distinguished guests, ladies and gentlemen, good afternoon. Assalamu alaikum. Asante. I bring you greetings from the President, His Excellency Dr. William Samoei Ruto. Mumepokea? Mumepokea salamu za Rais? It gives me great pleasure to join you here in Mandera as we officially open the Mandera Referral Hospital Satellite Blood Bank and also to launch the Health Taskforce report and hongera to Mandera County. Your Excellency, you wouldn't have gotten a better chair to midwife and deliver such a report than Professor. Asante, Professor. There are very few men in this country who can speak straight to the truth. And sitting here and listening to him, he is one of them. And Professor, among the wise men that I've been looking for to help me steer the ministry, you have earned your place in that list. Earlier this year, Governor Mohammed Adan Khalif paid me a courtesy call at Afya House. It was a late evening call, and we held discussions regarding the health status of this county. And I also told him about my priority areas in delivering universal health care. Today, I'm here to honor his invitation, which he had come to invite me to launch the task force. And I told him, that is too small for the CS. Can you look for other projects? And from that discussion is when we agreed that we have to ensure the equipment for the blood bank is here so that we launch it today. As we all know, universal health coverage is one of the priority agenda for Kenya Kwanza government and specifically His Excellency the President. Universal health coverage seeks to ensure that all individuals and communities in whichever part of this country have access to safe, effective, quality essential services without suffering catastrophic expenditure. This is based on the principle that everyone, regardless of their social status, income, should be able to access health care they need without their economic status. So indeed, I want to identify myself with a tagline from this task force of identifying, reaching, and serving with dignity. Ladies and gentlemen, allow me to recognize your governor. And for instance, I take note that the maternal mortality ratio has reduced from a high of over 3,000 per 100,000 live births in 2013 to 384 deaths per 100,000 live births in 2022. This is good progress, but it's not the best. There's still a journey, Governor. Ladies and gentlemen, my ministry is committed to supporting county governments in strengthening their primary health care services while also building capacity for specialized care, including critical care, renal and cancer services. One essential health service that forms a basis for quality health is the availability of blood. Today, my ministry, through the Kenya Tissue and Transplant Authority, has facilitated this satellite blood bank center in Mandera County that we launched today. Mandera County serves a population of over 800,000, and according to WHO standards, it should be able to process 80,700 units of blood annually. Whereas this was not possible before, I am confident that going forward, this is going to be achievable through the initiative that we have launched today. This is a significant milestone in improving access to safe and quality blood transfusion services in this region, and thanks to the efforts put in by all of us collectively and collaboratively. Ladies and gentlemen, I would like to appreciate all the concerted efforts and collaboration that ensured the successful setup of this blood bank. The launch today contributes to my annual target of achieving 400,000 units of blood bank collected and distributed by June 2023. We are on track towards achieving this target, and I thank you all for your efforts. Through the KTTA, my ministry will continue supporting counties by providing blood bags, testing reagents, among other necessities. In addition, we'll continuously monitor and evaluate blood establishments countrywide to ensure that safe and quality blood is readily available to all Kenyans who need it. Ladies and gentlemen, blood, unlike any other medical consumable and needs, cannot be procured or purchased through the normal way. I would like to implore and urge the residents of Mandera to develop a culture of blood donation. And I'm happy today we saw 3 gentlemen who are donating blood. Blood donation is a noble act that can save lives. This culture will ensure you provide adequate stock levels at the blood bank in the new center that we launched. We need you residents of Mandera, and especially the youth, who form a majority of healthy population, and thus qualify to be voluntary regular blood donors, to step up and donate blood. Looking across the room, I can see many of you here meet this basic minimum criteria to donate blood. I see almost everyone here could be weighing over 50 kilos. And the ages are 16 to 65, and those are the minimum criteria. And the faces are beaming with radiance, and you all look healthy. So you can donate blood. Ladies and gentlemen, today I also visited the County Referral Hospital, Kemri Laboratory, and the Kenya Medical Training College, Mandera campus. I once again would like to appreciate the level of investment at the County Referral Hospital and the collaboration between the 2 levels of government to strengthen service delivery in Mandera. The Kemri Lab in Mandera has made significant contribution, especially during COVID-19 pandemic and to the ongoing research. Previously, outbreaks including dengue fever, chikungunya, and Rift Valley fever have been reported in Mandera, and the county also lies close to where we had a yellow fever outbreak not so long ago. It is very important to strengthen our diagnostic surveillance and research capacity of epidemic-prone, emerging and re-emerging disease in the region. The capacity of Kemri Lab in partnership with the county government of Mandera will actualize on expanding the lab capacity. And Governor, I think that was one of your asks, and it is squarely lies with me. We are going to work on it. Indeed, we cannot achieve UHC without adequate health workforce, which has been alluded to by Professor in his report. Building satisfactory and skilled workforce is a priority for Kenya Kwanza government. KMTC is our frontier medical training college, and the Mandera campus offers certificates and diploma in community health, and I acknowledge the request to expand the courses to include nursing, clinical medicine, medical laboratory, and I have already asked, I can't see him, Dr. Kelly, oh good, that we fast track to ensure that these courses begin in September. As we fast track this discussion, Your Excellency Governor, I would like you to consider a revolving fund, just the way you have supported the high school education, a revolving fund to support the fees for KMTC students and also second teaching staff to the campus. Ladies and gentlemen, one can only address the challenges they have identified and recognize and implement a plan and strategy that has been thought through and concretized. I congratulate His Excellency Governor Khalif for the foresight of forming a health task force and applaud the task force for work well done. The report has succinctly identified the challenges and provided practical recommendations and actions points. I'm pleased to inform you that the strategies identified by the report align to the Kenya Kwanza strategies of Afya Bora Mashinani. And I'm confident that, Governor, once implemented, it will lead to a stronger health system and, most importantly, guarantee health care for citizens of Mandera County. Governor, I heard what the chair said, that he asked you whether you implement or not. As the CS, I want to ask of you to implement. Because if you implement, you will have implement for me as well. I am going to be the prefect. I have appointed myself to ensure that this report is implemented, so that even if we don't achieve UHC elsewhere, I'll achieve 1 out of 47 in Mandera County. My ministry is going to support you in the delivery of these recommendations, and you can count on me and the rest of my team at the Ministry of Health to provide the necessary support as needed. As I conclude, I would like to thank the county government of Mandera, led by your governor, for his foresight. I also want to appreciate the Ministry of Health staff who are here with me today, our development partners and stakeholders for your dedication and commitment to quality health services in the county and for making this day a success. As you begin this observation of the holy month of Ramadan, I wish you Allah's blessings and grace to see you through the fasting, and may your prayers, requests to Allah be granted. Asanteni sana. Allow me to say a few things. One is to most sincerely appreciate you, Governor, for extending invitation. I imagine if I was to go by my schedule, probably I would have gotten here next year at the end. But your invitation has brought me much earlier than my plan, which I'm glad and happy that when I have reached here, you've said since devolution, I'm the first CS for health to come to this place. This is my second time in Mandera. The last time I was here was 10 years ago, and I can confirm that I have seen development. I have also learned something today, which I'm going to use in my office. That this thing they call insecurity is a myth, Prof. Yesterday I spoke to my team and asked, should we go to Mandera or not? And I said, why not? Let's go. And here we are today. You know, people are expecting that people watakuwa wanaandamana. Kumbe watu wa Mandera wanapenda development. Hawako kwa shughuli ya maandamano, si ndio? Na nataka kuwashukuru sana. And on that note, I know that you are one of the counties that doesn't have the specialties from Cuba. Now that I have confirmed that there is no insecurity, I want to say the ones who are there yet to be deployed, we are going to deploy students. But the responsibility will be yours, Governor. I'll deliver them to your office so that you take care of them and ensure they provide services to the people of Mandera County. Si namna hiyo na wakuja wafanyie kazi. The other thing, as Prof has rightly put it, we have a lot of infrastructure in this country. It is not a Mandera problem. It is a national problem. That people have appetite for construction. Everything that we are doing around health is vendor driven. A vendor comes, they do a survey, wanasema hapa, if we put a 12-story building, itakuwa ni maendeleo. And that is what has formed most of the decisions done in this country. But I'm happy today because His Excellency the President is committed and he has said no more. We are going to implement the task force's report that have already been placed before us nationally. And he has said we are going to equip the existing facilities. And healthcare being one of his priority pillars, he's on it. Mimi ni kukimbia tu nakimbia, hata nimeanza kupoteza kilo kwa sababu ya hii kazi ya afya. But I'm not complaining because I know at the end of the day, if we deliver on his objective, on his priority, all Kenyans will be covered. And you're not alone. He has said we have to invest in primary healthcare. And from his team of advisors, I have come to learn that for every 1 shilling you invest in primary and promotive healthcare, you save 9 shillings in curative. And they say figures don't lie, isn't it? So it is only a fool who knows that if I invest 1 bob here, I save 9, who does not do it. So Governor, I'm with you. Kwa hii safari, we will implement this task force report jointly. Asanteni sana watu wa Mandera na Mungu awabariki.
I think now it's time for watching the task force report. I will request our Cabinet Secretary and His Excellency, Governor and Deputy Governor, to preside over it. And members of Parliament, please, you can also join. The task force team can also join this side. Just the members of Parliament and the task force team and majority leader representing the County Assembly of Mandera, please. So the chairman handing over to the governor and our CS witnessing. Yes. Thank you very much. Asanteni sana. So we can also say that the rest of the teams can be seated for the last part. Kindly be seated so that we can do the last part of the program. You will the host as you sit. Yes.
Yes, yes, to declare.
You can declare.
The launch.
The launch.
Yes.
Thank you very much, Professor, and your team for work well done. And I now declare the report, the Mandera County Health Reforms Task Force report, officially launched.
Thank you very much. Yes, I'm going to sit process for our 2 minutes so that we can complete the last part. Kindly be seated. Presenting some tips to our government secretary and our guest, and the team. Madam CS, kindly requested to just come to the stage here and receive a small gift for my kids.
Wala wengine lahza.
Kuonyesha fanya practice.
This is a traditional Somali attire. Karibu sana. Can be gift sani diyarisha. Abi gift can be gift diyarisha take na.
Suni. Tabi kama garbasa.
Wakan be gift to konga ya metiga kana kama tukana. Mbeg something.
All there.
Gift can be gift diyari take na to. Okay, just some photo ops. Thank you very much. Excellent.
I want to see a mirror.
Let the ladies take photos with her.
Thank you. Thank you very much.
Okay, thank you very much. Quickly,
Please, we need to skip lunch, please.
Okay. We are just handing over the rest also. Once we are done with the last photos of CS.
Ladies, wamekuwa ladies, kwa hivyo ni zamu yao. Ladies, hi.
The next person is Dr. Fortuna.
Yes, let's because of lunch.
Would we have a photo for the task force and the governor and the minister?
Yes, the photo is taken.
The next is Professor Mandera.
Just pray with it. Stay. Fight. Please. Taskforce. Speed up. Bro, cut the program. CS. What do you CS, man? What is CS? Wanapiga mapicha mingi sana tukiwa kwa ofisi ya gavana. So we are just repeating.
Okay, 1, 2, 3, 4, 5, all. Thank you. Member of the Taskforce, and thank you very much. Secretary. Wish you the best.
Please, just pray.
Just a few minutes for closing remarks, please. Please, few minutes for closing remarks.
Alafu announce.
Tena vote of thanks inshallah.
Idari wameacha residence ya gavana. Confirm ownership.
Taskforce nana hajapata visa. Taskforce nana hajapata.
Tabashir.
Oh, where is it?
Please.
What a sound.
Please, let's have a
Please pray.
الحمد لله وصلى الله وسلم على سيدنا محمد. ربنا ظلمنا انفسنا وان لم تغفر لنا وترحمنا لنكونن من الخاسرين. اللهم جمعنا هذا محروما وتفرقا من بعد معصوما. سبحانك رب العزة يصفون وسلام على المرسلين والحمد لله رب العالمين.